Let's talk about breast augmentation and breast lift. It is a little bit of a different animal than breast augmentation alone, and the reason why is because you're doing two separate things that are really at opposite ends of the spectrum. You're trying to lift and tighten and remove breast tissue and tighten the skin envelope. At the same time, you're putting essentially a balloon underneath the breast tissue and blowing it up. So those are two opposing forces. And so really, you have to be cautious and careful and really understand those dynamics and make sure you size the patient appropriately and remove tissue appropriately so you don't have a disaster where you take out too much skin and then put a big balloon in there and blow it all apart, and the implant is popping out through the skin because someone took too much skin and didn't realize that they were going to have to put that big of an implant in. One of the things that I counsel people, all my patients on, is that what I do is I do this in a very stepwise fashion to stay out of that problem. And so what I do is I mark where I think your nipple needs to be, and I put the implant in initially, and it's typically what we call a sizer implant, not the real implant. And then I can elevate the back of the bed so to mimic you standing, and then I can draw and actually tighten the skin and temporarily hold it in place. And so I can evaluate how tight the skin needs to be around the implant size that we're currently going to use, because obviously if I used a 200cc implant, I can tighten the skin more than if I used a 600cc implant. So where many surgeons draw and cut, close it, and then put the implant in, what takes me a little bit longer time, but I think is much safer, is to place the implant, put the bed, the stretcher that you're in, up, and so I can evaluate your breast, evaluate your tissue, and then I can mark and draw and tighten it accordingly to the breast implant we've selected, and also place the nipple appropriately in the best position, and that way we really limit the risks of over-resecting skin with an implant.